Heart auscultation. Perform hand washing before the contact with your patient. Provide privacy. Greet your patient. Prepare stethoscope. Clean the stethoscope with a cotton wool ball. The stethoscope is stored in a bag in a pocket. The auscultation room should be warm. The points method is used for auscultation of the heart. The stethoscope's membrane increases the sound. Membrane is used to listen the high-frequency sounds, the bell to low-frequency sound. We have two algorithms for the heart auscultation. Undress your patient, examine the chest, and start to auscultate the heart. The first method is you auscultate the apex of the heart to characterize S1 sound. It is mitral valve point for auscultation. The second point is second right intercostal space. It's aortic point to characterize S2 sound. The third point is point of pulmonary artery. It is the second left intercostal space for S2 characteristics. The last point can be xiphoid process point. It is tricuspid valve point to characterize S1. We have additional point. It is third left intercostal space. Let's start to auscultate the heart with using of bell. During auscultation, it should be quiet breathing of the patient, and you can propose to stop breathing during the auscultation of the points. After deep expiration, when you auscultate apex and base of the heart, second right intercostal space. After deep inspiration, when you auscultate xiphoid process and second left intercostal space. If stethoscope is not sitting tightly at the level of xiphoid process, you can shift this bell to the right, slightly right, or to the left. The second method is the next method. First you auscultate apex of the heart, after that xiphoid process for S1 characteristics. After that you are going to the base of the heart. You auscultate second right intercostal space and second left intercostal space to characterize S2 sound. And the last point of auscultation is same point. It is third left intercostal space near the sternal body. This is Bodkin-Erb's point as additional point for the heart auscultation. Apex, S1 characteristics, xiphoid process. We shift stethoscope slightly to the right. Base of the heart, second right intercostal space, S2 characteristics. Second left intercostal space for S2 characteristics. And last point is third left intercostal space close to the sternum. This is point for early diagnosis of aortic regurgitation. It's possible to auscultate diastolic murmur there. Now you can use membrane for the auscultation of main points. Quiet breathing, and patient can hold breathing. We can use different positions for heart auscultation. We start to auscultate the heart in standing position of the patient. If you hear additional sounds, for example, diastolic murmur, it's possible to change position. Sitting, bending, supine position, left lateral position for auscultation, for example, of systolic murmur of mitral regurgitation. Left lateral position, and hold breathing after deep expiration. To auscultate systolic murmur of mitral regurgitation. Sometimes we can auscultate neck. because aortic stenosis murmur can radiate to the neck or to the back, and hold breathing after expiration. After that, you'll use disinfectant for your stethoscope, and you can characterize sounds. For example, we have diminished S1 and systolic murmur on the apex.